I'm Chelsea from the Truro Council on Aging, and today with us we have Kathy Stetson, who's going to do an educational talk. Hi, Kathy. How are you today?
I'm great. How are you, Chelsea?
Good. Thanks for joining.
Thanks so much for having me.
Yes, we're excited to have you with us today.
And I'm hoping a few people will tune in and watch.
Yes, awesome. It's all you.
Okay.
Thank you.
Some of you know me from the exercise classes at the Truro COA. If you haven't met me before, I am a physical therapist and an exercise physiologist. And I've worked in many different clinical settings, including hospital, rehab, outpatient therapy, and home care. And for the last 12 or 13 years, I've focused on private and community exercise programs. And so naturally, as a physical therapist, there's a topic that's really near and dear to my heart, which is safety and fall prevention. Unfortunately, falls result in a lot of ER visits, injuries, broken bones every year. And it's hard to come back from something like a broken ankle or a broken hip. So this is a place where I feel like an ounce of prevention is really worth 10 pounds of cure. So there's a few things that we can think of, and we can think of two different categories. One is kind of some things that you're going to do with yourself personally and your body to help improve safety and decrease fall risk. And the second category will be what you can do with the home environment. And we'll cover that in the second part of the presentation. So I'm going to be presenting today. I've done community education before, but I've never done it on Zoom. So this technology is a little tough for me. High school was a long time ago, so I'm of that generation that isn't super comfortable with it. So I'd like to introduce my assistant, hi, who is also my son, Casey, and he's gonna be helping me with the tech aspects of the presentation, and he created the slideshow that you'll see later, and he's gonna just be moving the camera around, things like that. So for starters, Casey, are you able to get that to full screen, our picture there?
This one?
Yeah. I don't have my reading glasses, folks, and so I'm seeing a picture of me that's 1 inch by 2 inches. There, that's much better. Now I can tell what I'm doing. Okay, so first, my top 10 in terms of things that you can do personally to decrease your fall risk. Number 10, some medications, almost any medication, if you read the label, it'll say possible side effects include dizziness. This is the case with a lot of meds, but sometimes we need those meds to control blood pressure and so forth. So if you have a med that you find is consistently making you dizzy, talk to your doctor. They may be able to substitute something else, or they may be able to recommend that you take it at nighttime where the dizziness will be less of an issue. Number 9, eye exams. Vision is a big part of balance. So get your eyes checked regularly and replace your glasses when needed. The better you can see, the better sense of equilibrium you'll have as far as staying upright, and the more able you will be to see any obstacles in your path. So go to the eye doctor, get those glasses. Also keeping the eyeglasses clean. I am guilty of this. My reading glasses were really dirty, fingerprints on them, and it's fine if I'm lying in bed reading, but then I got up to walk across the room and I was getting dizzy and nearly went down on my face. So you want to avoid that. The next one on my list, when you're moving around, and you rise from sitting to standing, your blood pressure tends to drop. That drop in blood pressure can make you feel a little dizzy, lightheaded, a little unsteady on your feet. So if you've been sitting, once you get up, just try to stand still 3 to 5 seconds before you start going across the room. That could save you a lot of aggravation. The other thing, when you stand up, if you rise first, stand still, and turn second. I see a lot of people coming and going from the chair, and they tend to twist as they're sitting or get up and start heading to the phone. 2 separate motions, up or down, and turn separately, okay? So another tip, don't rush. Many of the falls, that's good on the camera. Many of the falls that I've seen over the years have resulted from somebody rushing, running to get the phone. This is why we have voicemail and answering machines, right? Take your time. It's not worth tripping over the coffee table to get to the phone and then you find it's a telemarketer. I don't know, card services, that lady Stephanie, she loves us, doesn't she, Casey?
Mm-hmm.
Yeah, so don't rush to talk to Stephanie. The next thing, posture. What Kathy always talks about posture. You guys that know me have probably heard this a million times, but when I'm standing upright, my center of gravity is really going to be in the middle of my feet. If I start to look down and lean forward, my center of gravity is really far into my toes, and it's not going to take much for me to fall forward. So as much as you can, you want to get those shoulders back, get the chin in so that your head balances on top of your shoulders, balances on top of your hips, centered over your feet. Can we pan down a little, Case? Let's see if we can get the whole body shot in there. Perfect. Okay, so if you dropped a plumb line from the ceiling, hopefully you'd see it go through my ear, my shoulder, my hip, and the middle of my foot. Another thing, it's summer, it's really hot and humid, at least it was yesterday. We are losing more fluid as we breathe and we're losing more to sweat. If you get dehydrated, that can cause you to feel, that's good on the camera. All right, let's just hold it there. Okay. If you get dehydrated, you may feel dizzy, lightheaded, or weak, and all of those things can make you more likely to have a fall. So remember to stay hydrated, drink plenty of clear liquids. Anything you can see through is good. No, not vodka. Water, fruit juices, herbal teas, those kinds of things. They say about 5 8-ounce glasses a day is good for most people. Depending how active you are, you may need a little bit more. Another key consideration with safety is footwear. Look at your shoes. Most of our walking shoes and running shoes are good for about 300 to 500 miles. And you'd be surprised that goes more quickly than you think. When the shoes wear, if they wear unevenly, if the outside of the heels wear down or the insides wear down, it's going to put you on an uneven footing. And that could be a problem when you're trying to maintain balance. The other thing that happens on shoes is the soles sometimes start to peel away from the upper. That little bit that's peeled away can easily get caught on the edge of the rug or brick out on the walk and send you flying. So check out those shoes. If the soles are coming off, maybe you can glue them on or replace the shoes. The type of footwear is also important. You really want to have something that has good traction underneath. Shoes without traction, we're going to pick up Casey's old gym shoes here. All the traction has, all the raised surface has worn down on this. So this is really smooth. He can literally practically ice skate across the kitchen floor with these. That's fun when you're an 8th grader, but for the rest of us, maybe not so cool. The other thing, footwear, a lot of people like to wear slippers, slide-ons in the house. So the problem with slippers, a lot of times they're slick on the bottom. On a wood or tile floor, you're not going to get any grip. The slide-on slippers, I'm always after my friend Diana about this one. Those little scuffs, you slide your foot in them. Let's pan down for a second, Casey. And then in order to keep those things on your feet, you end up walking like this, scuffing along in your scuffs. All right, let's take the camera back up. That's going to be a problem. Any change in level on the floor, you're going to get caught up there. So ditch the mules and the scuffs. The next thing, as far as balance, we have more balance when we have a bigger base on which to stand. So basically, the wider the feet, the better our balance is. If I stand with my feet very close together, I can't go too far in either direction without losing my balance. This is good, Case. If I stand with my feet further apart, I have a lot more leeway to move in either direction without losing my balance. This is why you see many athletes, different sports in this position. Wide base of support, their center of gravity is a little lower and they're not going to get knocked off their feet very easily. So widen your base of support. The next thing that you can do, heaven forbid you do have a fall, you want to make sure that you have any important information in a place that's very accessible if you require help from rescue. So at the Truro COA, they have these file of life folders. It's a little red folder with a magnetic back. Inside is a card. You can fill in your emergency contact numbers, your medications, any pertinent medical issues. You fold it up, you put it in this magnetic folder, and you put it on the fridge. If you have a fall and you have to call rescue, when they come into the house, the first place that they'll look for that type of information is on the refrigerator. If you don't have a file of life, call the Truro COA and they can get one to you soon, okay? Chelsea and the other folks over there will be happy to help you with that. And one more thing we can do to prevent falls, of course, I'm gonna say this, you guys can probably guess, exercise. The more flexibility that you have in your legs, the more strength you have in your legs, the better able you are to maintain your equilibrium or regain it and prevent falls. So when we talk about balance, it really is a lot about the legs, primarily the ankles and the hips. So I'm going to take a couple of minutes to demonstrate a few simple balance exercises. Any advice I give you here is not meant to replace the advice of your doctor or your healthcare provider. If you're unsure about your ability to exercise, always consult with your primary care provider before starting a new program. Any exercise that you do should be comfortable. You should be aware of the muscles working or feeling maybe a mild stretching sensation. It should not cause pain. If it causes you to have pain, please stop that exercise immediately. Okay, but on the whole, exercise is very safe and it's a great way to keep you on your feet, literally. So we're going to start with some that would be a little easier. Chair exercises. Casey's going to bring the camera down a little so you can see my feet and my head. Okay, good. So seated exercise, we said it's all about ankles and hips. So if we start down at the ground with the ankles, I'm going to slide my feet out in front of me a little bit and I'm going to raise the fronts of the feet. You can try it right now as you're watching. I'm strengthening the muscles here on the shins. If you have a small loss of balance, if you wobble a little bit, the ankles are the first things to catch you. You want to start modestly. If you haven't done a lot of exercise, maybe 5 or 8 repetitions, just enough to feel those muscles becoming active, and then stop and move on. The more you do it, the easier it gets, and you can increase your repetitions towards 10 or 15. The second exercise for these muscles on the back of the legs, the calf muscles, tuck the feet underneath you a little bit and you raise your heels. Now you can feel those calf muscles shortening a little, tightening a little. And again, if I were wobbling a little, my ankles would help to keep me upright, help to make those balance reactions. So maybe 5 to 8 repetitions there. You want to move slowly, lifting, pause at the end of the motion, and then lower slowly. Your muscles work on both phases of every exercise, the lifting and the lowering. If you get going really fast, you're mostly using momentum and you won't gain the strength from doing the exercise. Also going really fast on the down phase, gravity will do the work for you. Next exercise. All right, Casey's phone is ringing. Excuse us. Sorry for the interruption. Next exercise for the thigh muscles, the get up and go muscles. Sit all the way back in the seat, thighs supported on the chair, extend the leg. Getting up and down out of the chair and the sofa, in and out of the shower or the tub, all these things require some strength here in the quad muscles. Also, if you were to have a fall, You're much more likely to be able to get up on your own if you have more strength in the quads. So extending the leg and then lower. I'm trying to move slowly. I might have zipped through that last set because I was talking. That happens. We all know in strength training, sometimes that happens when we get excited about a subject that we're discussing. But I try to go slowly, pause, come down slowly, really get that muscle work here. Moving up the chain a little, we've got the hips. A larger loss of balance, people will usually use their hips to react and restore equilibrium. So strengthening the muscles in the front of the hips, sit up tall and straight, raise one leg with the knee bent, and slowly lower. You can alternate from side to side on this one as though you're marching. You will feel the muscles on the front of the hip engage each time you lift the leg. Most people feel this one a little sooner than the others, so you may not do as many reps. That's about 5 on each side. One other important thing on this one, posture. Don't worry about lifting the leg really high. I'm giving the side view. I'm trying to maintain my spine in a straight line. Remember the plumb line from the ceiling, ear, shoulder, hip. It's not worth it to get the knee way up here if I curl over like that. So straight spine, lifting the legs. The next one, also for these muscles, also for the hip, for the muscles in back now, the glute muscles, you can pick the leg up and move it to the side, set it down on the ground, move it back to the middle. You can keep going on the same side, or you could alternate back and forth. You want to do an equal number of repetitions on each leg for any of these one leg exercises, aiming for symmetry. And of course, on this one, just as on the last one, it's important to maintain that upright position in the spine as you move the leg back and forth. So there's a couple quick and easy things you can do from sitting. If you find those are easy and you would like a little more challenge, you can go to standing. I'm going to rise first, take the camera up. I'm standing still for a couple seconds before I go anywhere, and I turn second. When you do standing balance exercises, ideally you're going to have something sturdy to hold on to that is not going to move. I recommend the kitchen sink. I'm filming today in my bedroom, so there's no sink down here. I'm going to use this chair, but I wouldn't recommend that normally because if I really do lose my balance, I may tip the chair. So do as I say, not as I do. Sorry, folks, but I really can't film in the kitchen. There's too many dirty dishes. So I'm going to ask Casey to bring the camera down a little bit. If you were trying this at home, you'd be at the kitchen sink. Let's see, come back up, get a little more of the head. Okay, right there's good. And if you start at the ground and work your way up, same movements we did in the chair, rocking back on the heels, raising the toes. Those muscles on the shins again. As I do this, my weight's moving backward and forward. Notice that it's all happening at my ankles. I don't want to bend the hips and stick my bum out behind me. Second exercise, raising the heels. So I go up on the balls of my feet, lift the heels, and slowly lower. Calf muscles working here. My center of gravity is definitely moving forward. And then it comes back to its normal resting position. You can really feel the calf muscles working on this one because they're raising your body weight. Muscles start to feel a little warm, maybe a little tight. That's telling you they're getting fatigued. And that's where you would want to stop. Hip strength, the glute muscles, in addition to bringing the leg to the side, they also bring the leg straight back. So keeping the knee straight and reaching the leg back and forward. I'm touching my toe back there behind me. Strengthening the glute muscles here. Interestingly, if you put your hand on your lower back, you'll also feel those muscles tightening up a little, which means they're working. So those muscles along the spine help you to stand up straight and tall. You'd want to do an equal number of reps on the other side. Notice that I'm keeping my chest up. My leg doesn't move all that far here. That's fine. That's the way we are put together, the way the hip joint is built. Be careful not to drop your chest to get the leg back. It's all in the hip right there. And we'll take one more of those. The next exercise, I'm going to turn, just to give you a little different angle here. The glute muscles again, bringing the leg to the side. You could touch the ground, or you could lift the leg and lower. So this is coming from my hip. These standing exercises are a little more challenging than the sitting ones, so you might do less repetitions. I'll switch to the other side now, holding the kitchen sink, taking the leg to the side. Notice that I keep my body straight up and down. You want to avoid doing this, tipping to the side. Slowly moving out, pause at the end of the motion, coming back in. And one more when we're in the balance category. To get at the muscles that move the ankle side to side, you can take what I call a tightrope position. We've got a wider tightrope where the heel is next to the big toe of one foot. If that feels a little wobbly to you, you want to stay with that. If that feels really easy, you can switch the heel directly in front of the big toe. That's the narrow tightrope. We said a wider base of support is more stable. The narrow base of support here is definitely less stable. You feel the back ankle will wobble around a little bit as you maintain your balance. Any of these kitchen sink exercises begin with two hands for support. Let's give you the side view here. If you're feeling really secure with the two hands, you can move to one hand, or maybe even fingertips. And then you can begin to let go for brief periods of time, but always close enough to that sink that you could take hold of it if you needed to regain your balance. The back leg does a bit more of the work on this tightrope, so at some point you would want to switch the feet so the other one gets a chance there. Aiming for an equal amount of time on each side. Hand support as needed. You want to feel like you're working a little, which means you're a little unstable, but we need to have this safety so that you don't lose your balance and fall. Okay, so those are the exercises. There's many, many more things one could do with balance, but when you get to that, you might need some more individualized advice, either from a doctor or a therapist or a healthcare provider. So that concludes the exercise portion. And now we're going to move on to home safety, what we can do in the home environment. So give us a second to transition here. Casey has, in addition to helping me with the camera, he has introduced me to Google Slides. So we have a slideshow. And at this point, I think Chelsea's going to shrink my picture so that I won't obscure the slides. I want you to be able to see Casey's work. So, home safety and fall prevention. We're talking about the house and home environment now. Home is certainly where the heart is. We're all spending a lot more time at home nowadays with Corona. So it may be a good time to take a look around and see if it needs some attention in terms of improving the safety. And of course, why do we do that? Well, certain things in the environment can pose a hazard and ultimately end in a trip, a fall, an injury. But the good news is there's a lot of things that you could do to make your home safer and more accessible for you, for your friends, maybe for some older relatives who come to visit. And some of you watching this may think, well, I'm not elderly. I get it. I mean, maybe you're only 75 or 85, but also, you want to consider what happens when you're in good health, but also when you have something else going on. I met with someone the other day. She was in her early 70s, pretty active, but getting ready for a knee replacement. So she really needs to go through the house and make things safe for the level of mobility that she'll have right after the surgery. So we're going to go through their house, kind of a room by room approach, and talk about a few things that you can do. Coming into the house, the front yard, coming out from the driveway to the front door. A lot of us have brick walks or patios. Loose bricks and pavers are really dangerous because if you step on them, they may wobble. You could turn an ankle, or if they're raised up just a little by a frost heave or a weed that's growing underneath, you can catch the front of your shoe and trip. So the one on the left, thank you, Casey, for the graphics. That's what you don't want. The one on the right, keeping it in good repair, maybe getting a landscaper or a masonry person in there. Make sure it's smooth, level, clear approach to the door. Once you come inside the house, flooring. On the left, you see an area rug that's raised. It's not secured to the floor. So number one, it could slide. Number two, that raised edge can really be a problem if you catch your foot, maybe your cane or your walker on the edge of it, it will start to bunch up. Ideally, a carpet that goes from one side of the room to the other, or a wood floor, tile floor is preferable. It's all one level. There's no bumps or ridges to worry about. Remove those scatter rugs whenever possible. I know it's Cape Cod. Everybody loves their braided rugs. If you really can't part with them, you might think about getting rubber backing to make sure it doesn't slide when you step on it. It'll have a little more grip on the floor. Or you could consider using double-sided tape to secure it to the floor so that it won't slide and the edge won't get raised when you catch your toe or the end of your assistive device. Cords. We have so many electronics now. And of course, here I am, I'm plugged in with a camera, computer. We've got an electrical cord, an Ethernet cord, but you don't want it to look like this situation on the left. Cords running clear across the room, extension cords. Sometimes people run the cords under the carpets. They're all tangled up. It would be very easy to get your foot caught in one of those. What you're aiming for is something like what you have on the right. If you don't have enough outlets, you can bring in a power strip so that you can plug in multiple things in one place. In this picture, it's very clever. They actually secured the power strip to the bottom of the desk with Velcro. Then there's just one cord coming up from the outlet running right along the wall. So that's one thing to think about with your electronics, TVs, and so forth. Lighting. We talked about glasses before. We talked about how vision is a big part of your balance. So the room on your left is very dimly lit. It's going to be a lot harder to see obstacles in your way. It's harder to orient yourself to the environment, and that's going to cause problem with balance. The room on the right, of course, very brightly lit. You can see clearly where you're going. You could see any obstacles in your path. Just be aware of glare. You don't want really bright light on a reflective surface because that can create glare. And as we get older, our eyes are a little more sensitive to that glare. So look for that happy medium between the dark side and the light side. Right, Casey?
Mm-hmm.
Okay, next slide, please. Okay, I've definitely had this room here, clutter on the floor. Grandchildren, they love their Hot Wheels and their Legos and things like that. You step on a Hot Wheel, it is like a little roller skate. Pets, a lot of pets have toys, dog toys. Sometimes we put the magazine on the floor after we're done reading it. But all those things can really get in your way. If you step on them, it can be painful or it can cause a slip and fall situation. So the room on the right, of course, I don't know whose house is this perfect. It looks like IKEA in there, but they've got a nice clear shot across the room. There's nothing to get underfoot. Next slide, please. Bathroom safety. Bathroom is probably one of the more common places that people have falls, probably because of the fact that when you're getting out of the tub or the shower, you're wet and things are even more slippery. The tub is slippery, your feet are wet, the tile outside the tub or shower might be slippery as well. So we look at this room on the left, and you can see it's a very high step to get into the tub. It can be a little awkward with balance, trying to get the leg way up there and climb over. You see they've got a towel draped over the edge of the tub. A lot of people use those for bath mats, but they don't have any grip. So you climb out of that high shower and step on a towel, it may slide right out from underneath you. You can't see the bottom of the tub or shower, but certainly if there's no rubber mat or non-skid strip in there, it's going to be a little more dangerous. The other thing you'll notice about that room on the left, there is not really anything to hold on to coming and going, either from the toilet or climbing in and out of the shower. Take your attention over to the example on the right. They've got the shower. I think they're missing the non-skid rubber mat at the bottom of the shower. One of those things that will suction cup right onto the bottom of the shower, give you some more grip, but a great example of a low threshold, so it's very easy to step into it. And the grab bars to maximize safety, either when getting up or down from that built-in seat or climbing in and out of the shower. Staircases. Okay, I've done this a million times. I'm not going upstairs right now. I'll take that up later. So we pile up the books and the laundry and the water bottles and so forth. But that's really a dangerous situation. You can step on them, you can slip on them, trip over them, and so forth. So you want to keep those stairways clear and free of clutter. Wood staircases with the urethane finish are very slippery. If you're thinking about a remodel, you might consider doing carpet on the stairs, or at least on the top surface of the step that you're standing on. It's going to give you a lot more traction. The other thing to look at is the stairs themselves, making sure that they're in good repair. You don't want the tread to be loose or boards to be lifting up. And of course, a handrail really helps a lot. So making sure that's in good repair, that it's securely attached to the stairs. You see in this example on the right, they have one handrail. So you're going to be holding, let's say, with your left hand as you go up and your right hand as you come down. That's fine as long as both arms are strong, but heaven forbid if you break one arm, it would be nice to have a railing on the other side so that you could use the stronger arm to hold on both coming and going. So considering railings on both sides if possible. So those are some simple things you can do around the house and the yard to help decrease your risk of fall. I just want to thank Chelsea for inviting me here today and all the folks at the Thoreau COA. Thank Casey for his assistance with the tech. And thanks to all of you for tuning in, and we hope to bring you more programs soon.
Thank you so much, Kathy. We appreciate your time and for being with us today.
Thanks, Chelsea.
And thank you to your amazing assistant, Casey, as well. Have a great day, guys.
Okay, you too.
Thank you.
Bye.